Welcome to today's video about the 8 early warning signs of hypothyroidism. What if I told you that your body is sending you signals right now? Signals that could change your health completely, but you're probably brushing them off as normal. Every year, millions of people around the world live with an underactive thyroid and have no idea. The thyroid gland is a small butterfly-shaped gland in your neck, but it controls nearly everything. Your energy, your weight, your mood, your body temperature, even your memory. When it slows down, so does your entire body. Here's the unsettling truth. Medical research shows that most people dismiss the early symptoms of hypothyroidism as normal aging, stress, or simply being out of shape. But what they don't realize is that their thyroid is desperately trying to tell them something critical. Today we're going to uncover the 8 early signs of hypothyroidism that most people completely overlook. Some of these may surprise you, like a symptom that shows up in your eyebrows, or why you're gaining weight despite eating the same as always. By the end of this video, you'll know exactly what to watch for and when to seek medical attention. Let's get into these important warning signs. Please note, this video is for informational purposes only and is not a substitute for medical advice. All information is based on verified research. Now let's begin with sign number 1. Fatigue, feeling unusually tired or sluggish, even with enough sleep. The first warning sign that most people wave off as, quote, just getting older, is an overwhelming persistent fatigue. Not ordinary tiredness that improves after a good night's rest. We're talking about waking up after 8 full hours of sleep and still feeling completely drained, as if you hadn't slept at all. When your thyroid gland is underactive, it produces less of the hormone thyroxine, the chemical messenger that tells every cell in your body how much energy to produce. When thyroxine levels drop, your body essentially shifts into a low-power mode. Your muscles receive less energy, your organs work more slowly, your brain struggles to stay alert. Research from the American Thyroid Association confirms that fatigue is among the most common and earliest symptoms of hypothyroidism, yet it is also the most frequently dismissed. People often blame their job, their schedule, their stress. But this is a key distinction. Hypothyroid fatigue doesn't improve with rest. It's persistent, it deepens over time, and it progressively robs you of the energy needed for activities you once enjoyed without effort. Don't dismiss this as simply being run down. If your tiredness has no obvious explanation and doesn't go away, your thyroid may be at the root of it. Next, sign number 2. Weight gain. Unexplained weight gain, or difficulty losing weight due to a slower metabolism. The second warning sign is unexplained weight gain, and this one catches people off guard because they know they haven't changed their diet. This isn't weight gain from overeating. This is your body quietly storing more fat because your metabolism has slowed to a crawl. Your thyroid hormones are your body's metabolic engine governor. They determine how quickly your cells burn calories. When thyroid hormone levels fall, your resting metabolic rate drops with them. Your body burns fewer calories throughout the day, even when you're sitting still. The excess energy gets stored as fat, particularly around the abdomen, face, and extremities. Clinical studies show that patients with hypothyroidism can gain anywhere from 5 to 10 pounds, sometimes more, in the early stages, even without any change in diet or physical activity. What makes this particularly frustrating is that no amount of dieting or exercise fully resolves the weight gain until the thyroid is treated. If you're watching what you eat, staying active, and still gaining weight inexplicably, or if the weight simply won't budge no matter what you do, this is your thyroid sending you a message. Next, sign number 3. Cold intolerance. Having a low tolerance for cold and feeling chilled more easily than others. Here's a symptom that often goes unnoticed because people simply adapt. They reach for a jumper, they turn up the thermostat, they blame the weather. But feeling persistently and disproportionately cold is one of the telltale early signs of an underactive thyroid. Here is what's happening inside your body. Thyroid hormones regulate thermogenesis, the process by which your cells generate heat as a byproduct of burning calories. When your thyroid slows down and hormone levels fall, your body generates less internal heat. Your hands feel cold, your feet feel cold. You're sitting in a warm room and reaching for a blanket, while everyone else is perfectly comfortable. Research published in major endocrinology journals confirms that cold intolerance is present in a significant proportion of hypothyroid patients, often appearing early in the disease process, before other symptoms become obvious. Doctors specifically ask about this symptom because of how reliably it points toward thyroid dysfunction. The key distinction here is not feeling cold during winter. Everyone does. The warning sign is feeling significantly colder than the people around you, in the same environment, for no clear reason. If friends or family regularly comment on how cold you always seem, or if you've developed a new need for extra layers and temperatures that never bothered you before, don't ignore it. The patients who get the fastest diagnoses, the most accurate treatments, and the most respected conversations with their doctors all have one thing in common. They come prepared. This tracker makes you that patient. It documents your symptoms, your patterns, your progress. Useful for any health condition, anytime. Without it, your symptoms are just words. With it, they're evidence. Get yours now. Link is in the description. Next, sign number 4. Dry skin. Skin becoming itchy, flaky, or noticeably drier. The 4th warning sign moves to the surface of your body, literally. Changes in your skin can be one of the earliest and most visible clues that your thyroid is underperforming. Thyroid hormone plays a critical role in the normal cycle of skin cell renewal. When hormone levels are adequate, your skin cells regenerate at a healthy pace, keeping your skin soft, hydrated, and smooth. When thyroid hormone drops, that renewal process slows dramatically. Dead skin cells build up on the surface faster than they are replaced. The result is skin that feels rough, looks dull, flakes easily, and may itch persistently, particularly on the elbows, shins, and feet. Research from dermatology and endocrinology literature notes that dry, coarse skin is found in a large proportion of hypothyroid patients and is frequently one of the first changes people notice, often months before they suspect a thyroid problem. Unlike ordinary dry skin caused by weather or dehydration, hypothyroid-related dryness is generalized, persistent, and does not respond well to standard moisturizers. If your skin has become noticeably drier, rougher, or itchier without an obvious cause, and especially if moisturizers aren't helping the way they used to, your thyroid may be to blame. Next, sign number 5. Hair loss. Significant thinning of scalp hair, loss of the outer third of the eyebrows, and potentially thinning body hair. Hair may also become brittle or coarse. Here is a symptom so specific that doctors are trained to look for it the moment a patient walks through the door. And yet most people either don't notice it or blame it on something else entirely. Thyroid hormone is essential for the normal growth cycle of hair follicles. When levels fall, hair follicles prematurely enter a resting phase and stop producing new hair. The result is a diffuse thinning across the scalp, not the patchy loss of alopecia, but a gradual overall reduction in hair density that makes the scalp more visible, particularly at the crown and hairline. But here's the detail that makes this sign particularly distinctive: the loss of the outer third of the eyebrows. This specific pattern, where the tail end of the eyebrow thins or disappears, is considered one of the classic physical signs of hypothyroidism and is something physicians actively check for during examination. Body hair may also thin, and the hair on the scalp that remains often becomes dry, brittle, and coarser in texture. Medical literature confirms that hair loss associated with hypothyroidism is diffuse, bilateral, and often gradual, which is precisely why people attribute it to stress, aging, or nutritional deficiency for months before the true cause is identified. If you've noticed your hair coming out in larger amounts on your pillow or brush, if your scalp feels more exposed than it used to, or if the outer ends of your eyebrows seem to have quietly disappeared, your thyroid deserves a closer look. Next, sign number 6. Muscle and joint aches. Experiencing muscle weakness, stiffness, or joint pain. The 6th warning sign is one that leads many people straight to an orthopedic clinic or rheumatologist when the real answer lies with their thyroid. Unexplained muscle weakness, persistent stiffness, and aching joints are early manifestations of hypothyroidism that are routinely misdiagnosed. When thyroid hormone levels fall, it affects muscle metabolism at the cellular level. Muscles require thyroid hormone to maintain their normal contractile function and repair processes. Without adequate hormone, muscle fibers weaken, cramp more easily, and take longer to recover after use. People often notice this as a general sense of heaviness in the limbs, difficulty with tasks that require grip strength, or stiffness that is worst in the morning and improves slowly throughout the day. Joint pain in hypothyroidism occurs partly because fluid can accumulate around joints when thyroid hormone is low, causing swelling, stiffness, and discomfort that mimics arthritis. Research published in endocrinology journals shows that musculoskeletal complaints are present in a substantial proportion of hypothyroid patients and frequently precede the formal diagnosis by months. What makes this symptom particularly insidious is how naturally people attribute it to aging, overuse, or a prior injury. If you're experiencing muscle weakness or joint stiffness that has no clear structural cause, and especially if it's appearing alongside other symptoms on this list, don't stop at the orthopedic clinic. Ask your doctor to check your thyroid. Next, sign number 7. Depression or low mood. Feelings of sadness, a lack of motivation, or general mental low. This next sign is perhaps the most emotionally significant and the most frequently misdiagnosed. Depression, persistent low mood, and a pervasive lack of motivation are well-established early symptoms of hypothyroidism. Yet countless people are treated for depression for years, without anyone ever checking their thyroid. Thyroid hormone has a direct effect on brain chemistry. It influences the production and regulation of serotonin and dopamine, the neurotransmitters that govern mood, motivation, and emotional resilience. When thyroid hormone levels drop, so does the brain's capacity to maintain emotional balance. The result is a low mood that isn't tied to life circumstances, a flatness that doesn't lift, and a motivational emptiness that makes previously enjoyable activities feel pointless. Research from major psychiatric and endocrinology journals consistently shows that hypothyroidism is associated with depressive symptoms in a large proportion of patients, and critically, that these symptoms often resolve with thyroid treatment alone, without antidepressant medication. Studies estimate that between 40% and 60% of people with subclinical hypothyroidism report mood-related symptoms before receiving a formal diagnosis. This is not about being in a bad mood. This is a chemical change in how your brain functions, driven by a hormone deficiency that is entirely treatable. If you or someone you know has been struggling with low mood, loss of interest, or emotional flatness that doesn't respond to therapy or lifestyle changes, a thyroid function test should be part of the conversation. Next, our final sign, number 8. Memory issues/brain fog. Difficulty concentrating or feeling mentally cloudy? The 8th and final warning sign is one of the most disruptive in daily life, and one of the most commonly dismissed as a consequence of stress, poor sleep, or getting older. We're talking about brain fog, a persistent difficulty concentrating, a frustrating inability to retain information, and a general sense of mental cloudiness that descends on your thinking and refuses to lift. Your brain is one of the most thyroid-dependent organs in your body. Thyroid hormone is critical for maintaining the speed of neural signal transmission, the pace at which your brain processes information, retrieves memories, and executes decisions. When thyroid hormone levels drop, those processes slow. Words take longer to come. Thoughts feel like they're moving through fog. You reread the same paragraph multiple times and still can't hold the information. Research from cognitive neuroscience and endocrinology consistently demonstrates measurable declines in memory, processing speed, and attention in patients with hypothyroidism, even those with only mildly low thyroid function. Clinical studies show these cognitive changes can appear before other physical symptoms become obvious, making brain fog one of the earliest neurological signals of thyroid dysfunction. What makes this symptom particularly distressing is how personal it feels. People describe it as losing a part of themselves, their sharpness, their confidence in their own thinking. They adapt by writing everything down, avoiding mentally demanding tasks, or withdrawing from situations where they fear their memory will fail them. This is not normal. It is not inevitable. And it is not permanent. For most people, cognitive symptoms respond well to thyroid treatment. If you've recognized yourself in any of these 8 warning signs, don't panic. But don't ignore them either. Hypothyroidism, when caught early, is a highly manageable condition. The key is recognizing the signals your body is sending you and acting before a minor hormonal imbalance becomes a serious health issue. A simple blood test, measuring your TSH and thyroid hormone levels, is all it takes to find out. It's quick, inexpensive, and it could explain everything you've been experiencing. The most important thing to remember is this: these symptoms develop gradually, and they are easy to rationalize away one by one. You might tell yourself you're just tired because of work, just gaining weight because of the holidays, just feeling down because life is hard. But when multiple symptoms from this list appear together, especially if they are new or worsening, your thyroid deserves to be ruled out. Modern medicine has highly effective tools for managing hypothyroidism. Most people describe their symptoms from memory, and memory is unreliable. This journal changes that. It works for thyroid issues, hormonal health, chronic fatigue, anything. Patients who present documented symptom logs to their doctors report faster diagnoses and better treatment outcomes. Doctors love the clarity, and it dramatically improves your chances of getting the right treatment faster. Don't walk into your next appointment empty-handed. The link is in the description. If this video was helpful, please type helpful in the comments below. It lets us know that this content is making a difference and motivates us to keep producing health information like this. Please like, share, and subscribe for more life-saving health content. Thank you for taking charge of your health. Your body is speaking. Now you know how to listen.